there. Welcome. How are you doing today? Good. I'm doing well. Thank you. Thank you for asking. I really appreciate that. So you're here for a cleaning. Is that right? Good. You said, how long has it been since you had your last cleaning? Do you know? You can just give an approximate date. That's completely fine. A year or two. Okay. No, I understand. And I noticed right off the bat, I noticed you have braces. How are those treating you so far? I know they're a bit of a challenge, especially with, cleaning and brushing, flossing, especially flossing. I had braces myself. Yeah, that's pretty typical. You don't have to worry about that. We can work around that. We actually, I might actually be able to remove these. I think that's how I'm gonna approach this. I'm gonna remove your braces. First, I'm just gonna have a general look before I take anything off to make sure that, by me taking those braces off, you're not gonna have any issues, pain. You don't have any pre-existing conditions. Do you have any that you know of? No? Okay. That's really good. That's good. It should be a fairly simple process. I basically just take those braces off. I'll detach the glue from the front of your teeth, and then I'll go ahead and do a plaque removal, and then we'll do a polish, okay? Make sure we'll check for any cavities and if we have to do any fillings and things of that sort, but it looks to be, you look to be in pretty fair health. I know you mentioned you brush your teeth at least twice a day. That's really the minimum that we recommend. So just from a looking at you perspective right now, without digging into anything too far, you look healthy and well taken care of. So I can appreciate that. I appreciate you for taking care of yourself. It's important. But what I'm gonna do is I'm gonna put my gloves on. I'm gonna lay you back and give you a nice pair of glasses. Okay, this really fresh pair of Oakleys, and we'll get to the cleaning. All right. So just relax, and I'm gonna put you back here. All right. Are you nice and comfortable? I've got you laid back here, and you're currently looking at a TV monitor, so we can, I can point exactly to what I'm looking at and your beautiful smile here. So I'm gonna go ahead and put my gloves on, and we'll get started. Okay, how's that pillow feeling? Is that all right? Good. Okay, are you ready for your dental inspection and cleaning? Good, let's go. Okay, so here's your pretty smile here. Just gonna turn your head to the left. Okay, seeing a couple stains, possible cavities, and turning your head to the right. Maybe 2 or 3 more. Nothing that we can't take care of. Trust me. We are good at what we do. So I'm just gonna have you open your mouth, say ah. All right, perfect. Thank you. I'm just going to use my mirror here. Oh, that's the toothbrush. Sorry, I'm looking at your mouth while I do this. I don't want you running away on me. I'm just gonna use my mirror here, okay? And I'm going to depress your tongue. say one more time for me. Just inspecting your uvula and your pharynx, your pharynx and larynx. I always get that confused. Pharynx and larynx, because it's laryngitis, not laryngitis, So just, a quick look at your vocal cords and a bit of your throat, okay? Everything looks good and clear back there. Now I'm going to look at your teeth. I'm gonna show you because I actually have a good view from my point of view, but just gonna show you that looks good. That looks good. Okay. Heading to the front of the bottom of your mouth. Looks good. Looks good. Okay. And on the right side, that view seems to be a little blocked. Turn your head from that bracket right there. I don't know if you can see that bracket that's around this back tooth. But everything else looks really good from the interior, so you can close your mouth just a little bit. I don't want you to close it too much. And then here, I'm going to actually look at it myself, okay? Same thing so far here. It looks pretty good. It looks good. Your top teeth are in really good shape. Yep. Oh, this bracket's a little bit loose, actually. I'm gonna pop those on. None of that hurts, does it? Okay, you can close your mouth. So, I'm gonna put that mirror away. So I'm sure you can kind of see, turning your head here, you have one on the back right bottom, another possible cavity or stain on that tooth in front, one on top, on one of your eye teeth, another one on this bottom incisor, and it looks like one more on the top row of teeth. So I've got 1, 2, 3, 4, 5 spots that we've got to work on, okay? So I'm gonna have you open your mouth. I'm gonna grab my pick, and that's gonna help me take off your braces, okay? So this is gonna be fairly simple. I'm just going to pluck on each of these brackets. There's 2 on the top, 2 on the bottom, as I'm sure you're aware of. And I'll begin to gently pry these anchors on each one of your teeth loose, and then we'll get to the cleaning, and you'll be in and out of here faster than you know it. So let's go ahead, and I'm just gonna gently start to pry on each of these. You can actually kind of rest your mouth. I'm just gonna put my finger in there as a barrier so you can rest, and there's still a gap for me to work. Just don't bite me. And let me know if I'm hurting at all. I don't want to hurt your gums or anything. I don't like when dentists do that to me, or orthodontists. Oh, there it goes. One just popped loose. Okay. Turn your head just a little bit. I'm going to switch hands, so I'm just gonna do this real quick. Again, please don't bite. Just let your mouth relax. And we'll get this bottom off real quick. And then there it goes. Okay. So here we go. This bottom set of braces. There you go. Looks to be in good shape. Just doing a visual inspection of the brackets and the anchor points. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 anchor points, not including the brackets. I'm going to set that on this tray here, on this handy dandy dental tray. And then we can go ahead and start working on this top set of braces, okay? So I'm going to do the same exact thing, and I'm actually going to get a little bit closer. I'm going to get a little bit closer, and this time I'm just going to push down. I'm going to push down, okay? Oh, that top bracket came off real easy. Just turn your head to the left, please. Okay, a little bit more. I'm going to switch hands again, so please don't bite. Just allow your jaw to relax. Okay. Oh, that one popped off too easy. Just making sure it's completely off. And there it is. When's the last time you saw your teeth like that? It's probably been a couple years, right? So I'm going to set this, do a quick visual inspection. We've got our 2 brackets, 1, 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 anchor points. Everything looks to be in good condition, no buildup, no problems with excess glue, and the wires are in good condition, no breaks at any point. The brackets, again, no breaks, firmly attached to the wires and the brackets, or the anchor points, excuse me. Set those on the tray and put those aside. And here's your smile. Let's go ahead and have a good look and head to the right a little bit. Any of your gums hurt over here? Just gonna kind of drag my fingers across the top of your gums. Tapping, does any of that hurt? No. They look nice and pink. No redness, no whiteness, no receding. Any of this painful? A little chomp there. Nothing but a reflex. Nothing to worry about. It happens, especially when you're opening and closing your jaw at the dentist's office. We see it all the time. Yeah, just got on closer inspection. We've got that spot right there. 2 on the bottom on the right, 1 on the top right. Front teeth look in good condition. 1 on the bottom middle, bottom left-ish. And then, okay, good. We only have 1 more on the top left there. Open up just real quick. I'm gonna do some tapping, some wiggling, okay? Your teeth might feel a bit strange after having those braces on for a while, okay? Anything strange on the bottom? No weird sensations, good. I'm just going to do the same thing. Let me know if any of this feels strange. Just looking for any nerve problems, any sensitivity, maybe a little pain there, okay. You might have a little bit of a cavity right there, but nothing is too loose, no extreme nerve pain, so I'm going to give you, a pretty clean bill of health as far as your hygiene goes, aside from these spots that we're going to take care of, okay? So no crazy nerve pain or anything like that. So let's go ahead and get it to the cleaning. All right, so we have 2 flavors. We've got this chocolate. It's not that great. I mean, we shouldn't make chocolate toothpaste. And then we have strawberry watermelon. This is the favorite. Okay, good choice. So basically what I'm going to do is you're going to keep your mouth closed just like you are. And I'm going to take this tool, okay? And it's got, a specialized bristle head. It's a bit rubbery. And I'm going to dip it in here. Just make sure that it fully saturates the bristles, the brush, the tool head, whatever you'd like to refer to it as. That looks pretty good. I would say so myself. What do you think? Good to go. All right, set that down. And put this lid on of our strawberry watermelon fan favorite polish. Okay. All right, so I'm just gonna start on this bottom row. Okay. I'm gonna work on these 3 teeth down here at the bottom, making sure to hit the point at which your gums meet the bottom of your tooth, okay? In circular motions. Those look pretty good. Now I'm gonna work on these 3. Boom, right away. We got that stain off. It was not a cavity, it was just a deep stain. Alright, turn your head just, a little chomp there. Turn your head to the left just a little bit. Working the middle right of the bottom teeth. And going further to the right. Just keep turning your head to the left. And just like that, your bottom teeth are clean, no cavities. They look great. Fantastic. I'm really happy with that result. Let's go ahead and attack these top teeth, shall we? We've got just 2 spots. I think they're going to clean up nicely, just like the other ones. I'm going to start on the left, just like I did last time, okay? So keep your head to the right for me. Working those 3 teeth here. Again, where the teeth meet the gums especially. I want to make sure we're getting in between the crevices here. Turn your head to the left, center. Left more, thank you. And then all the way to the left if you can. Okay, it looks like we're gonna have to go in with the pick and just kind of scrape at the surface. It's a little bit of built up plaque. No worries, let's go ahead and start that right now. Okay, so I'll be very gentle, and I'm just gonna get nice and close so we can see what we're doing here. I'm just gonna scrape at the surface of that tooth. And it's clean. Look at that. Just beautiful. Can you even recognize your teeth? Look at this. Perfect. Okay. Let's get this last spot out of here, and we'll get you ready to go. So I'm just gonna again get nice and close. And scrape. And just like that, all of your teeth are now stain-free, plaque-free. Beautiful. I'm stoked that we could give you a nice clean smile. Okay? And you know what? I think the metal braces are a bit much at this point in time. And I think we can go ahead and get you onto the plastic retainers, which is basically like Invisalign if you are familiar with that. So one last look. Tilt your head back just a little bit. Everything looks good. Your teeth look amazing. Tongue looks healthy. Gum line is healthy. I'm very satisfied with that. So, let's go ahead and get these plastic retainers put on. And we'll get you out of here with a couple goodies. Okay? Open your mouth, please. Thank you. Let's see. Is this the bottom or the top? This looks to be the top. Okay, it's fitting a bit awkward. So let's just, we'll just get nice and close here so I can see what we're doing. I'm tapping it into place, okay? Just making sure it seats properly. Do the curvature of your teeth. How does that feel? Does everything feel okay? There's your top one in. Perfect. It fits great. And then here's your bottom. Oops. Don't fall, please. Let's go ahead and... Oh, that was satisfying. That was satisfying. Making sure we tap it into place, just like the top. And close for me. Beautiful. How does that feel? Just let me know. I know you have a bit of space, but that's normal because you have a lining of plastic on your teeth now. But that looks way better than braces. Are you happy with that? Perfect. Okay, good. Good. Now, I'm going to send you home with some nice minty toothpaste, okay? So you don't have to go buy any from the store. If you're running low, here you go. I've got a bit of floss for you. Make sure you're flossing every single day. It's very important. That removes the excess food between our teeth that, eventually rots and will turn into plaque. That's not a good smell, and it's definitely not good for your gums or your teeth. Okay, so there you go. And a nice toothbrush that comes preloaded with some toothpaste on there. Nice, and you can just make sure you hit all those gums from the top. Nice circular motions, again, like we talked about. Up and down, round and round. Okay, got it. I'm going to set that stuff to the side. And I'm just going to do one last look with my light here to make sure I have a better view. Make sure, actually, let's go ahead and take these retainers off one more time. And I'm going to just ask you to tilt your head back for me. Nice big smile. And I'm just going to give a general look. Make sure we didn't miss anything. To the left. Looks good. To the right. And then open up for me. Okay. Bottom teeth look good so far. Checking the back sides of them, the insides of the bottom right, the tops of the teeth, and then the tops of the teeth, or the top teeth, rather. Making sure everything looks good. I didn't cut you up at all, did I? No pain. And then again, looking at the tongue and the throat. Close for me, open for me. Just want to Did your jaw feel all right? That is really good. So you can put these on at night. Just make sure to wear them all night. You can wear them during the day too if you are comfortable doing so, but your teeth are moving pretty far along, so you should be pretty set. You should be good to go. You have any questions for me? I'm just going to put these in your retainer container. A retainer container. Can you believe it? And do you want to keep your braces? No? Okay. I figured not. Anyways, I'm just going to turn this mirror up to me and say, thank you so much for coming in. I'm glad I could take care of you today, and I hope you come back again soon. So I will see you in the next one. And as always, please, please, please have a good rest.